So welcome everybody to this session about developing healthcare ecosystems that generate health. I'm quite excited for this session today. For those of you who this is not your first session, we're continuing to build on a theme we talk about. How do we really create a health system that builds health and well-being in our communities? What I want to do now is just set a bit the stage, get us kind of oriented to what we will do for the day. And I wonder, Josh, if you mind just scrolling down a bit in terms of the mural board. So we'll use this to kind of guide our conversation, but also as a presentation format. So today I'm Anne-Marie Parent. I'm one of the volunteers at the SI Health Hub. I'm joined with my colleague, Rosina Malagrida, who's also working with me to organize activities like this at the Health Hub. And we have Josh, who from the SI Network, who's going to be facilitating the session today for us. So as you saw from the calendar invite, this is a 90-minute session and it's meant to be interactive, although we'll provide you with some context and some information to get this going. The session is recorded and we usually post the recorded session on our YouTube channel for folks to be able to catch up. Often these conversations generate a lot of great insight. Through our facilitated process, what's going to happen, it's going to generate kind of an image or a map that we can then use as we are engaging with our communities or to get idea. And so as a result of our conversation today, this map will be created and then it'll be available and shared with all of you if you want to use it to continue conversations or use it to reflect even more on what we discussed today. So in terms of what you can expect, here's our agenda. It's a 90-minute event, as I mentioned. We're starting off with a 10-minute introduction. In a moment, Ushma will talk about her work and present the challenge statement for us to work into. Josh will facilitate this workshop to get us going on those conversations, and then we'll wrap up with a short outro. But before we get started, because these sessions, are international, it would be really good if you could go to the Miro board. So if you cannot see it, or we can ask for the link again, Josh just put in the link, a link to the Miro board. If you can move to where you see the map under Icebreaker, and what we would like you to do is to grab one of the Post-its and just move it to wherever you are located in the world today. So I'm from Ottawa, Canada, and you'll see I am moving it that part of the world. What I always find fascinating when I participate in these sessions is how, despite us being from all over the world, there's a lot of commonalities in the challenges we experience with our health system. And so there's always some great learnings that we can get from that. Oh, and I also see you from South America as well now. That's great. So for those of you who are just joining us, you may want to look into the chat. There's a link to the Miro board. We're just asking you to grab a Post-it and to share your link. Oh, and actually see some folks are putting their LinkedIn links into their Post-it. So feel free to do that too if you want to connect with others in the network. So maybe while folks continue to place their Post-its on the board, I will now pass it over to Ushma, who's with Ripple, who's going to just share some information about the great work she's doing and help us launch into our challenge question. So we'll be a bit inspired about some things that they're trying to do differently to create health systems that actually support health and well-being. Passing it over to you, Ushma.
one too many times on the mute button. Thank you so much. I'm so excited to meet you all today and work together with you on improving our health systems, and talking about health system transformation. I thought it would be good to try to show a little bit about me without using any words or post-its. So that's why you'll find a lot of images here. My name is Ushma. You see lots of countries on there. So thank God, Anne-Marie, you didn't ask me where I'm from on where to put the post-it in the map. That would have been a bit difficult. You were very specific on where I'm located, and that is in Germany at the moment. So that's why you see the German flag in there as well. I'm originally from India. I was born in the UK, that's why you see the UK flag, and I lived both in Singapore and in the Netherlands for a long time. So I bring a lot of experiences across the globe today. You'll find on the left side of a big number with some medical devices. Those are basically, that's my background. So my career has been for 10 years in the medical device sector. I've basically worked in all sorts of health systems across the globe, but always from the perspective of a company or from the perspective of the industry. And that kind of shaped a lot of our thinking within my organization, but also the way the challenge is being set, that we're going to talk about in a second, as well, comes, of course, a lot from the experiences that I had from working in the industry. I love to travel. I like to. I was initially putting lots of yoga and and books in there as well. And then I was like, it looks far too nerdy. I definitely have to put some. I asked my sister, I look super boring. So then she was like, oh, put some. I do love to dance and to party as well. So that's why I put some dance and music and party in there as well. I also love to travel. So you have the whole earth and globe in there as well. Always very keen to explore new countries and new cultures in my private time as well. So that's a little bit about me. And we're going to dive into the challenge first before I'll explain a little bit about my organization as well. But the challenge basically came from, and you find the term, there's a new term that we're kind of trying out, which is called, which we're calling sicking now. But it's basically a term, and you will recognize the different models, as the different images as well. I recognized, of course, the way I was working as well in the corporate world. The way we are used to sitting in front of the computer all day long and working, mental stress, overload, watching TV or Netflix, and all of those habits that kind of have shaped throughout the last couple of years in the way we work, in the way we live, in the way we eat. And it kind of, I became aware of it quite early on in my career when I had to sell medical devices to patients. And I was good at my job. I was good at selling my products. But the problem was that I got not the problem, but the good thing was that I got a bonus the more medical devices I was selling. But I felt bad after it because I realized that I was earning money while other people are suffering. And that's kind of the moral dilemma that kind of we will be speaking about a bit today. That it's a moral dilemma that not only I face, it's a moral dilemma that is very, once you think about it within the industry, but also for a lot of doctors, this is the case, that they feel there is a tension. So for anyone, I was really inspired by the book called The Ethical Doctor. And there is a tension that we experience between wanting to earn more money and wanting to actually do something that's actually good for people. And sometimes that goes in two different directions. And that's kind of where the challenge comes from. We have an entire system, an economy that doesn't necessarily support healthy behaviors. And then because disease is created, we have then an entire system that kind of catches up us and earns money from the fact that we're ill. And then we go back into the kind of vicious cycle. Of course, all is not that bad. We can see directions that are moving toward what we are terming healthing, where there are trends. You see a yoga mat, you see nature, and these are all related to the food sector as well. Sleeping is important, healthy lifestyle, activity, nutrition, all of these things are important. But wouldn't it be cool, and this is kind of the challenge for today as well, wouldn't it be cool if we could combine both of those things in terms of earning money while ensuring that the environment is staying healthy? We have introduced the term healthing because when we talk about prevention or earning money while people are healthy, then we're still kind of in the mindset of thinking from the perspective of disease. We talk about health promotion sometimes within the health sector. Health promotion for me is, it's great to promote these things, but it also would be good to act on them, right? What are the activities that we're actually implementing to ensure that it's easier for people to stay healthy, and to ensure that this follows throughout the different societal levels. So even the most vulnerable communities, that they also have access to physical activity, to wellness, to mental health topics as well, and have exposure to a healthy environment. So the challenge for today kind of is to really think about how can we move our system from a sicking one, and I'm really focusing on challenging you to think about the economic angle of how does this happen, how do we want to realize this in today's economic world, and how do we translate that into something from toward a healthy one, and again make it economically feasible. So there is a money bunch in here. Let me just go down and point my mouse here. There is a money a box here with a big question mark on it. Is basically, how are we earning money in the future, and is it something that we can envision to do while being healthy and while supporting people to stay healthy as well. I'll just quickly introduce Ripple. Ripple is the organization that was founded in 2023. We basically support both governments and businesses to realize this transition from sicking toward healthing and make that economically viable. And we do that by creating different tools that support them in the decision making to make the case around prevention or healthing, and to make it work in a sustainable way as well. My sister works in climate change and sustainable buildings. And I would say that she, in her world, has kind of taken ownership of sustainability. When we talk about sustainability, we often think about climate change, but I want to challenge it and kind of to say, you know, we would love to have a healthing system, but in what all we're doing is basically saying that the health system that we currently have is not sustainable. So we want to bring sustainability into our health systems, and that I think looks toward one that looks at combining the economic argument and the prevention argument in one. So those are the things that we do. Of course, those have benefits into society as well. So I just kind of showed you the model here a bit about our theory of change. We are supporting both businesses and governments, and they impact the society. And that's our vision, of course, as well, that it's super, super easy to stay healthy. So any questions? Of course, I'm super happy to. I'm going to be here for the next hour and 10 minutes. So bombard us with any questions that you might have or ideas. And I'm really, really looking forward to all of your ideas. This is a change that's very big and bold, and it cannot be done alone. So we definitely need your proactive help and your enthusiasm and ideas as well for this. I'll hand it over back.
Thank you so much. Go ahead, Josh.
Yes, I was just going to say thank you, Ushma. You might want to drop a link to Ripple in the chat so people can take a look at that. But great framing. I think it is a sustainability challenge because the way we're doing things is very unsustainable, isn't it? I mean, the US system is the most extreme. It's heading towards trillions and trillions of dollars per annum that can't be afforded. So I think it is a sustainability challenge, and the core of it, as you say, is this kind of tension between the economics of what we're attracted to at the moment and the incentives and the default positions, which often run contrary to what are the best long-term outcomes for our health, and how do we resolve that tension and conflict, I think is a great way of framing it. Yeah, I'll just jump into the next section then. Hopefully everyone has the mirror board. I'm going to share that again. Yep, rapidly approaching $10 trillion, right? 10% of GDP in the United States, and many other countries, the UK too, where I am, is also in a pretty bad situation. And it's not just the system, it's also it's everything, it's outside the system too, isn't it? It's those choices that we're set up to make. So actually we need to visit that whole equation. So here we are today. That is what we're going to visit in the spirit of kind of holism and systems thinking. We're looking all the way across the board. And at the center, we have that challenge we just mentioned. It is developing healthcare systems that are regenerative in some sense, or they're creating health, they're healthing instead of depleting that resource, should we say. And what we're going to do is look across different dimensions and firstly think about the challenges. What's creating that situation that we know at the moment? What are the blockers to actually creating healthy ecosystems? Why is this system the way it is at the moment? And we're going to look at that across these different dimensions: technological, environmental, social. Down here you can see cultural, and to the right you can see economic, and you see circles here, right? So initially we're working in this first circle here, where we're going to post up the challenges, the current issues. And then we're going to move to the second circle, and we're going to post up opportunities for overcoming those. So just give you an example of that. We'll take his challenge and center, and we'll go here to what's one of the blockers. I posted one up. We are in this section around environment, up here and infrastructure. So built environment not designed for physical activities. There's car dependency, creates an attractor towards inactivity in many parts of the world, many cities. And that is a blocker. That is a issue, a default attractor we find ourselves in that leads towards sicking, as you call it. And how do we get to healthing? What's the opportunity to change that? We might think about integrate new thinking and metrics into urban and transport planning to account for and work to optimize for physical activity, and making it a default instead of the most difficult, make it an attractor within the system. So that's one example. I had another little example going down to culture. Culture is all about mindsets, mental models, values, even behavior and so forth. So if we have one of the challenges at the moment, the current paradigm sees the healthcare system's job as one of sickness care. It's about taking care of people when they're sick. And how could that change? What's the opportunity to change this assumption and increase awareness of the job of healthcare systems to be around generating health, and having to kind of look outside the box and collaborate with many other areas actually to do that. So that's that. Hopefully you're getting the idea. First box, we post in the challenges. We look across these different dimensions. So environmental is all things to do with, water, land, food, physical environment. Technology is like manufacturing and, information technology and energy and so forth. Economics is business, finance, economic models, logistics, commerce. Culture is all things about mental models, values, paradigms, behavior, and so forth. Social is all things to do with social interaction, education, law, politics, governance, and so on. Media also would be down here under culture, I guess. So hopefully that's making sense to everyone, what our activity is here, or at least the board. And we're going to start now in this first circle here, where we're posting up the current challenges within the system that's leading to the current state. We are going to take 8 minutes to do some posting, so we have a little bit of time. We're going to listen to some nice, calm, smoothing music so that you guys can all think about this one and think about it across the different dimensions, whichever one is most relevant for you, you're most interested in, you have ideas around. We'll do that for 8 minutes. What we also want to do is try and surface interesting ideas. As mentioned, we're going to try and create an outcome from this afterwards in terms of the interesting ideas we came up with. To do that, it'd be great to have your voting. So if we post up ideas for 8 minutes and then we take a couple of minutes to read over some of what we see, you people read over other things that you've seen and vote on them. So voting, you'll have, let's say, eight dots per circle. And if you take one, if you see an interesting idea, drag it onto that idea just to raise it up to the surface so that we can start to discover what we're all interested in, what we think is interesting. And you can vote upon a few different ideas. We'll take a couple of minutes to do that, and then we will host a conversation based upon those stickies, hearing what's there and your ideas and anything you want to talk about here. So there we go. Everybody know what we're talking about? Everybody get the idea? Maybe you've been to one of these before. We have hosted them quite a few. So I put the board in the chat again, and we will get started with 8 minutes to start getting cogs turning in your heads and stickies posted up on the board. And we'll come back afterwards and do some voting. Put in the chat if you need help with anything. If not, off we go. And indeed, try to keep your stickies to a reasonable size. That would be helpful. I wouldn't call this a reasonable size. This is what we call an unreasonable size. Yes. So let's try to keep our stickies down to the kind of size we see here so that they can all fit in. You might like to choose your own color so that you can find yourself. If you're not familiar with Miro at all, you grab a sticky on the left-hand side here and you drop it in like that, and then you type away. It's pretty simple, and you can just drag your sticky around or move around with your trackpad, zoom in and out. Remember to post your ideas in the correct segment so that we can cluster those, whether it's social, economic, technological, and so forth. We are on this second circle here, so let's stay in that circle for the moment, and we're posting up the current situation across these different dimensions, the current challenges that are creating the current system. If you need help, just post it into the chat and I'm happy to help you.
Sorry, Josh, do you want us to put the lines so that we link the challenge with the opportunity?
It's okay. Well, we aren't posting opportunities at the moment, so just post the stickies up. Maybe afterwards you draw the lines when we get to opportunities.
Okay.
And if you don't have access to the board, you can post it into the chat and I'll post it up for you. Okay, lots of ideas going on here, and you're still posting, so feel free to stay posting. But for others, you might like to start voting. That would definitely help us. So we'll take 3-4 minutes to, as mentioned, grab a dot, and let me just set these up for you. Grab a dot or up to 8 dots for different ideas. You can put more than 1 dot on the idea if you like it. That's a sticky. By idea, I mean a sticky. Just take a read over and drag dots to the ones you find interesting, so that we can hopefully get some collective intelligence in terms of surfacing the interesting ideas here. We will take 4 minutes, and then we'll come back and have a conversation about those. And feel free to stay posting ideas if you still have some. Maybe that's enough time for the voting. It looks like we're starting to surface some things here. Lots of great ideas, and thanks for all the posting in the chat. Also, I moved those across, but maybe I'll pass it over to someone to share with us. Rosina, would you like to share with us anything interesting that you saw here, what you voted on, or some idea?
Yes, definitely. We can see some post-its where there are quite a lot of votes. For example, in this area here, we can see that it says that system offers one-off individual interventions rather than collective transition pathways, which has 4 votes. And beside it, the fact that the funding models mainly focus on single organizations, perpetuating the current fragmentations. And next to it, another one with 2 votes saying policies do not penalize the externalities, of products that cause health problems.
So should we try to hear from whoever it was? Yeah, maybe we'll move on. Who posted these ones? Do you want to share?
Actually, I posted these ones, Josh.
Excellent. Okay, a little bit biased, aren't you, Rosina? Yeah. So say a few words then. What do you think about this?
Well, basically, yes, this need to go towards collective efforts that is not easy because the funding models and the policies do not facilitate those. And also the externalities, the policies do not penalize when there are externalities that are not doing good. And this links to other postings by other people that were also saying similar things, like, for example, yeah, the paradigm that healthcare is something that is done to me rather than something I participate in. So here they are also calling for this collaborative effort that is required. Or there was another one that I found very interesting, this blue one here, saying that non-communicable diseases are seen as a market opportunity for return on investment can be very clear if we calculate that. So here we have a very nice opportunity.
And why do you think, just briefly, system offers one of individual interventions rather than collective transition pathways? Funding models mainly focus on single organizations, perpetuating the current fragmentations. I mean, afterwards we'll think about, opportunities of ways to kind of respond to that. But what do you think kind of drives that, Rosina, or creates that?
I think that what creates that is the lack of systems thinking, the fact that we are working with a fragmented approach. And it's difficult to change that because who is going to give the funding to start changing that? So we need policies that start facilitating these collective efforts. Otherwise, it's very difficult to find the leverage point here.
We start to see some of them, don't we? These missions and all of that sort of stuff. But yeah, I think this is the default we know so far. So maybe I'll go on. Ushma, did you want to pick up on anything?
Yeah. So, I mean, I just want to add to what Rosina mentioned. The fragmentation and lack of systems thinking is very interesting, that you can see that across the entire circle. So you see that on the economic side with what the sticker that Rosina mentioned, but then also on the cultural side, you see, I think it's at the bottom, lack of holistic view of our well-being. So even our body is perceived as fragmented, right? So you have a cardiologist and you have a nephrologist and you have an endocrinologist, right? The whole kind of who is the person that's looking at the entire body, and then also the and that's, I think I saw a couple of stickers in the environment area as well, that the relation between our body and the environment is also looked at. There are two different departments in the government. So this fragmentation and lack of systems thinking goes from within the medical, like within our bodies, to our relation to perhaps even other people, but also our relation to nature and the systems that we work in. So I think a couple of stickers, and it's interesting because it kind of also, in a way, we're fragmenting the circle as well in different departments. So we can see that pattern across the circle, which I find, of course, very interesting. Yeah, that's one observation that I basically made.
Yeah, maybe Adrienne has something she'd like to add to that, but I'll just say that was one of my big insights when I first spent time in hospital about 14 years ago and had an operation. I was in bed and had a few days to observe the healthcare system as like a tourist, but I got plenty of time to try and think about how this system is working. And what I noticed was the way every day a new doctor or nurse would come up and pick up the bit of information into my bed and say, "Oh, what's wrong with you? You had an operation. Which leg was it?" And so on and so on. And then they'd put it down and they'd go away, and then someone else would come and they'd pick it up. Oh, what's your name? What's wrong with you? And you start to realize that the whole system it tries to optimize things by breaking them into small parts that are kind of interchangeable, and anyone can come and pick it up, and so forth. But then you realize that may drive some sort of efficiency within the system, but your experience is hugely sub-optimized by that, right? And you think about how much is lost by that lack of integration around your experience. So yes, you get this efficiency by chopping everything up, but you lose so many other things at the same time. So I think it's also in the design, isn't it, of the system? But maybe Adrian, do you have anything you'd like to add?
It does make it less efficient. And I think it's very exhausting for the consumers because you do have to tell them your story again each time. And then if you ask, you know, who's working on this, what am I expecting to hear from them? What types of tests did they do? When am I going to hear from them? Who's going to follow up on that? It's just completely fragmented. So the coordination it's very wasteful.
Mm-hmm.
And I think it's just very confusing. I'm not sure how that affects dropout rates with treatment, but it's highly inefficient.
I think it creates huge vulnerabilities for errors and so forth. You know, the way they keep on asking me, which leg did you get operated on? You know, like the surgeon would know that, but it does create, I think, there's so much gaps there, isn't there, created where so many things can go wrong. And the information, it just flows so badly. That was my experience from the outside. Anybody else want to pick up on this topic before we move on, of kind of fragmentation across the board?
Yeah, hi, Josh. Actually, I'm in the hospital right now, so that's the funniest part. But one thing about, like, you know, when you talk about fragmentation and not everyone asking the same type of question because they don't have time to read the chart. So that shows, like, you know, the reason why they're fragmented, working in the hospital and being a healthcare professional, is because they're burnout. And so they never have time to, you know, read the chart.
Yeah, I mean, that's one we'll get to, burnout. But Anne-Marie, do you want to add something?
No, I think there's also interesting conversation happening in the chat, Josh, and lots of comments about incentives. And for sure, I think that's maybe one part of it, but I don't think it's just an incentive problem. Like there's a big mindset or mindset, like I don't know who wrote it. I think it was Scott, that most, like this conversation, all these things, there's nothing new in the challenges we've identified. You could go to a lot of meetings and the same stuff keeps coming up. So how do we shift kind of the mental models of the system? Because a lot of the big change in other systems weren't just a change in incentive that kind of made it happen. So that's what I'm curious about is beyond incentives, what are things that would truly shift the system? Yeah.
Yeah, so good question. And anybody else want to share, like down here, these kind of mental models? How are they creating that situation? What's the kind of opportunities there? I mean, the paradigm that healthcare is something that's done to me rather than something I participate in.
And maybe just to add on to Anne-Marie's point, I think one other thing is also taking an approach from the cultural sense, is not only making things visible in relationships. So if I'm having a different fragment, like I'm taking a fragmented view of the body, the way to take a systems approach to it is kind of shine light on the relationship between my heart and my lungs, right? What is the relationship between those, how they're influencing each other? And in the same way, the departments in the government, from the health department to the finance department, what are the relationships in between the two? And one other cultural part I always give that as an example is we all, I think, have been raised with Disney movies, and you know, the hero in all the stories that we have been taught since we are children and since like forever, right? I hear the stories of heroism from my parents and from my grandparents, etc. And the hero is most of the time, and it's not always, of course, but most of the time, someone that saves the day in the last moment. Right, everything like Batman, Spider-Man, and all of the, I'm not an expert of all of these things, but the one that saves the day in the last moment. So there is, let's say, subconscious value to or admiration to the person that kind of can tell you, look what I did for you, right? Like everything went wrong, you landed in the hospital and I am saving you, right? And that kind of heroism and that admiration also for the doctor is something that also needs shifting in our minds, to perhaps think about how can we value someone that is preventing all of these things, right? How do I value the urban planner that has done all of the biking paths for me in the Netherlands, for example, so that my heart is healthy and I don't even, diabetes is not even a thought in my head, right? Because I'm also so much in the healthing, engaged in the healthing part. So how can I make them the hero of our society? Right. And
it's lots to do with visibility, isn't it? And information. Like we don't really have that visibility in who designed this pathway and so forth, but we get to see the doctor in front of us who just kind of saved us. So we do have huge opportunity, don't we, with the data available to us and the technology we have to make those kinds of things visible and maybe start to account for them, the kind of choices we make in that way, or these planners and so forth make. Adrian?
So I was wondering, building on what Anne-Marie and Ushma were saying, what everybody else in the group thinks about the invisibility of preventative care versus treatment. So you don't immediately see the feedback loop really. So for example, with COVID, the flatten the curve visuals, how that helped people visualize hospital capacity and projected demand. They could see real time that there's something at a scale where usually you can't abstract to that scale. They actually showed people, and I saw and I felt how that shifted my behavior as a nudge. So, how much of this that with mental models and that invisibility, as you're saying, of these, actually, that's even a narrative, actually. How much of that plays into what you're saying, and what does everybody else think about that, even as far as incentives?
Yeah,
Yeah, I mean,
oh.
go on, Emery. Yeah.
I was just going to build. I know in reading some of Brene Brown's work, she was saying there's two ways to kind of get people to change or see the world differently. One of them is like if they're in awe of something, like a positive future or something that's possible, that's one way. Or the other way is through fear, showing them an undesirable outcome. And I think that's what the flatten the curve did when you saw these scenarios and you go, if we don't get this order, like our whole health system is going to crash and you're not going to get any service if you have a broken arm or another thing. Or so I think people understood the magnitude of the problem then, and that got people acting. And it didn't have to do with money or benefits, but it had to do with, so I think people connecting either in awe or in fear of something that they can truly believe, and that relates to them. That's that's
and
interesting.
it connects to collective action too. As Rosina was saying, it really moved entire populations, which was pretty impressive. Exactly.
Yeah. Through a kind of a meme too, wasn't there? Like bending the curve, But I mean, again, to go to the mental models thing, it's kind of, we talk about the things that we can see and we value the things that we can see, and we see the things that we can structure and comprehend, and our mental models kind of shape what we view, and that feeds through to what we value and what we start accounting for. And things that are too broad and diffuse and complex, we zone out, don't we? And we focus on the doctor in front of us and how great a job he did and so forth. So, I mean, I think it's that thing of creating model-like systems thinking, help us think in systems so that we can see and somehow start to bring that information in and in some way kind of simplify it to the extent we're able to create a meme and a movement and get people seeing systems and valuing them and recognizing that that's the infrastructure that kind of shapes everything.
I would pick up on that and just say we were talking about incentives, and there's a ton of systemic misalignment around incentives, but incentives are also intrinsic to your own person, individual experience. And that is, when you're young, you're too immature and inexperienced to know that the decisions that you make throughout the every day accumulate to raise or lower your risks, to improve or not improve your health. Like, that's why young people smoke. That's why young people take risks. That's why young people drink more. And so there's no immediate feedback loop that pushes against you when you're making those choices. Those choices build up over decades, and then you deal with the consequences. And even in socialized systems, there's an issue with, well, if I don't really have any pushback or disincentive, then I can consume, I can do whatever I want, and somebody else will pay for it, and I don't have any skin in the game, as we would say. And that lack of education and literacy and sort of visibility into my consequences, it skews my incentives throughout my life. And that is one of the problems that we have with not being able to educate people or scale some of these things that we've talked about, is until people understand that the choices that they make throughout the day are going to impact their health for the rest of their lives, without knowing or having that sort of instantaneous feedback, it's very difficult to change people's incentives and their behaviors and the choices that they make.
Yeah, and in that respect, I always give the example of, you look at these packets of cigarettes these days and they have gruesome things on them, It used to be a fashionable thing to smoke 80 years ago. And then we started realizing all this stuff and the taxes started going up. And then I'm talking in the UK here, in the past decade, the pictures on those packets have got incredibly gruesome. And so that's a kind of double feedback in terms of the incentives. Like I used to smoke when I was a child, and it was like £3 or something for a packet, and now it's like £20 or something for a packet. And then so it's the incentives, but it's also the feedback from, this is what you're doing to your body and your lungs when you look at that packet and so forth. So you're starting to really, in that scenario, after 60 years or 100 years or whatever it is, we're really starting to get a strong feedback. And now I looked at the data, it's really dropping off the cliff. In the UK, it used to be almost 60% men, 55% women smoking, and now it's down to 10% kind of across the board. So and it's really dropping off the cliff. It's quite rare you see people around here smoking. So I think that's an interesting case study. But just quickly back to the COVID and the memes, there was also an interesting thing there about simple rules for you to adopt to take the right behavior in terms of social distancing. Stay this far away from your neighbor, stay a few meters away and put a mask on, So I think there also has to be some action that people can take to really enact the whole thing too. Okay, so we have half an hour left. Maybe we move on to the second circle. I think there are great points there. The second circle is about what do we do about these challenges, these issues. So again, try to follow the same sectors in terms of the environmental, technological, economic, and so forth. And if you did post up challenges here, then of course you can post up, responses, opportunities that we find at this time. So you might like to, as we were saying with Rosina, draw a little link so we know where it's coming from, where it's going to. And let's take about 8 minutes or so to do that before we come back again. If you have any questions, feel free to drop them in the chat, or any comments, I can put them onto the board. Okay, we'll just take a couple of minutes to do some dot voting on these ones so we can see what ideas you think are best surfacing here. So maybe just 2 minutes or so before we have a conversation about that. Dots are on the left-hand side here. Okay, great stuff. So Rosina, maybe I'll pass it to you if you have something you'd like to pick up on.
Well, do you think we should first vote in order to be able to see what's interesting, or do you want me to pop up with something?
Well, we could stay voting whilst you maybe pick up on anything that you find of interest, Rosina. Yeah, or what
Yeah,
you posted.
okay. Okay, maybe we can highlight the ones that come from the ones that were voted previously, right?
Okay,
So,
yeah, we got some up here.
yeah. For example, here up, lack of interoperability and usable health records has a solution that has been suggested, saying government regulators policy requiring interoperability for devices, electronic record systems, etc. So here there is a very technological solution being suggested. Other cases, there are solutions with AI as well that are coming up, also very technological. And on the left side, we can see also solutions calling for collective and transition processes. So rather than one-off interventions focusing on empowering community structures in transitions. It was nice also this one here, helping ambassadors show, don't tell. So this is a solution for communication. And there was another one to create an observatory, because we are seeing that there is a need for data and for visualization of this data as well. And
Yeah.
also raising awareness of policies. So there are many that are about looking for what's already there and making it more visible, analyzing it, showing numbers, making it visible, apart from doing these collaborative efforts.
Amber, want to speak on this one? Feedback loops, equivalence, counterfactual.
Yeah, so again, need for new knowledge, in this case on system dynamics, right? So feedback loops
Mm.
and equivalencies, yeah. So showing with numbers what is the impact of what's happening or what could be done.
Adrian? Mm.
Yes, that builds upon what we were talking about earlier with Anne-Marie and then with Ushma. Really making it visible, producing, really enhancing the ability to create a mental model, to create a representation of something that would otherwise be latent and difficult to grasp, especially with systems thinking, because it really just goes against the reductionist view, the tendency to see what's right in front of you, to look at something in a compartmentalized, siloed, immediate linear way. That this could be a step to kind of transition people to that mindset, that you're able to see, as 3 examples of concretizing preventative care, because it doesn't have those immediate feedback loops. I know, Joss, you were mentioning with the cigarette packaging, that now they're really showing you. I think that is a great example of a counterfactual, that they can show you, here is the result of what would happen to you if you continue doing this. So here's the prevented result, instead of letting you get there and then you have an illness. So you can see in advance, it's giving you that kind of future self view. You could also, again, with the COVID flatten the loop, that would be a feedback, flatten the curve, that's a feedback loop that's visualized, so you can actually see it instead of having to get there and have the negative result. And then also with, let me zoom into that, equivalencies, the ability to take something such as risk or some other very intangible abstract concept and concretize that as something that someone can relate to, something that's more concrete, like time or money. So each flu shot, for example, saves $30 in doctor's visits. So you can really, people can actually grasp it in a way that's accessible to them. So I provided 3 examples for that. Also, crash test dummies. So I remember watching those PSAs a while ago, and they were very impactful. You could see this is what happens if you continue to engage in these unsafe behaviors. These are the kinds of injuries, kinds of fatalities you can experience. And it's very visceral. You see them and you put yourself in its place and you say, no, I don't want that to happen to me. Much more than someone just telling you, drive safely. That's too abstract. That's too nebulous. So those are 3 examples I provided of how to concretize it. I don't know if anybody else has seen any other examples of that.
Maybe I could just pick up on 1 or 2 aspects there. I mean, wow, this technology, right, the algorithms and data is really going to accelerate that ability to make those kind of predictions of, like, if you do this behavior, like, this is going to happen, and visualize it back to us, isn't it? That's going to just radically increase, I would say. I mean, the question then is, do we want to see that data, and what are the biases we build into it? But another one I want to pick up on here is in the UK, open finance has been very successful. And open finance was a movement to open up the data within these institutions. So you had to make it accessible. And then a gentleman I know who led part of that initiative is now leading another one around open data for, carbon accounting and so forth. So all these companies have to open up their data around shared protocols and standards, so that you can unlock that data across these enterprises and different institutions. So then it's accessible to, startups and anybody else who wants to build things on it. We kind of need open healthcare, I'm sure there are lots of them, but that's the problem, like, broader kind of protocols for open healthcare data. Scott, did you want to add?
I did. Going back to the preventative marketing, there's a lot, if you zoom to the bottom, I think there was a lot of thought around trying to make health and prevention sexy or attractive. And the examples we gave around smoking and seatbelt use, those worked really well. It took 20, 30 years, but the rates for lung cancer and respiratory illness related to smoking are way down since the 90s because of those campaigns. So they do work. The problem is we haven't been doing them with all the other scourges that the rest of society is promoting, like poor diet and sedentary lifestyles and things like that. And I'll add, on the technology side, in healthcare, we are drowning in data. There is tons of data, but it is very fractured and tends to be siloed and inaccessible to citizens, particularly their own data. And doctors and health systems don't get paid for a lot of that data. Your doctor doesn't really want to know how well you've been sleeping or what you've been eating for the last 30 days. She just wants to know what the trend there is. She doesn't get paid to look through that data. And that's an example of misaligned incentives. I will say there is a lot of development over the last few years of using that data to create digital twins, where you can then run out simulations that say, all right, if I do this, this, and this, what do I look like 5 years, 10 years down the road? What's my health status? How much money did I spend, right? And we've had models for decades that can predict what your health status will look like 10 years down the road, how much money you will have spent or cost the system if you continue to engage in a particular pattern of behavior. But we don't reflect that back to individual citizens, right? We use that for policy and reporting and all these other things, but individuals don't generally get access to that. But that is changing now with a lot of digital twinning and simulation tools that are becoming available.
Yeah, you mentioned health insurance should be part of kind of closing that loop also, although I'm sure there's issues. I don't know, Andy, it's good to see you here. Are you with us? Do you want to pick up on anything? Mr. Wilkins.
Thank you very much. No, apologies, I joined very late. I've just come from another meeting, so I've missed the vast chunk of this really important and valuable discussion. But whole person, whole system approaches are absolutely needed, but are so difficult to bring about. And where do we draw the boundaries? If we look for treatment, but to secondary prevention, primary prevention, what is the role of individuals? What's the role of communities in fostering the conditions to make this possible? And what are the role of policy in shaping the environment that makes possible healthy choices? All these things are interlinked at multiple levels. And one of the interesting things I've been trying to work on, as you know, Josh, is trying to get my head around all of these pieces and say, what could a future health system look like in the 21st century that could address these challenges, to internalize the externalities, embrace the possibilities of new medicine and new technologies. And part of this is trying to get with more clarity what such a future might look like, so that different pieces could come together in a new conversation about building some of the enabling capabilities to take us on this journey, that there is both evidence and support and hopefully momentum that more systemic, holistic approaches can yield changes in the short term, but also signal the sorts of transformations that make possible a change at a larger scale. All of this, of course, complicated by what kind of a financial model drives the incentives of the system. Here in the UK, we have a public health system that wants to reduce its costs. So therefore, there is a kind of energy in the system to try and find ways to maximize the health and well-being, to reduce the costs that then fall on the taxpayer. If you move to other private health systems, you've got different dynamics at play. So this is the most complex of all complex systems. So it's fabulous to be part of this conversation, and fascinated to hear what everyone's sharing.
I think what you say really gets to what we're doing here in terms of how can we think across all those different dimensions, as you say, and try and get the best kind of equation or best set of things come into sync, should we say? Because we know it's not normally looked at like that. It's normally we optimize this thing, we should do this, and that's going to get the results. So I like what you're saying, and it's always going to be a kind of crude look at the whole, isn't it? And it's going to be far from perfect and all of that. But if you can get kind of alignment, it can create something quite powerful, and kind of systems change, right? Ultimately, can't it? So I think it is what we're getting at here. Anybody else want to pick up on this topic or another one, Anne-Marie or anyone else?
Well, just another, I find people generally have an aversion to complexity. So as soon as we're faced with the magnitude of the issues and understanding all those links, like people go into shutdown mode and like, no, give me a part that I can handle, that I can control, that I can claim success on. And so I wonder sometimes, how do we build that resilience or that capacity to go, well, no, we got to sit with the discomfort to be able to get through understanding this complexity, getting the players in. That's been my reaction or experience as I did in the health system, is there is a, oh, this is making me uncomfortable. Can we find a simpler way? Like there isn't. Yeah.
Yeah, I think it's part of the job of kind of leadership in some sense to try and simplify or get this complexity, help people make sense of the complexity, isn't it? In a way that they're able to be prepared to lean into it and then kind of work with it. Because most people won't want to look at the big messes, but some people will, and they have to kind of try and create those sense-making ways that other people can kind of start to work with it, I think. Yeah. Anyone else? Any other topics? Ushma, we're going to draw to a close. Any final thoughts or? Yeah.
No, I think I really love the variety of topics that we kind of addressed today, from increasing awareness also in creative ways. I really love your comment, Anne-Marie, on the fact that we kind of need to endure the discomfort of finding this too complicated. So I think I'm still in that discomfort, I think, working within my organization as well. But I think there is a lot of value in also looking at the things that are not working and trying to find a way to turn it around. So for example, just the commercial determinants of health, right? Understanding how nudging works within the industry and how they have been successful in behavior change for their benefit, but then finding ways to turn that around. How can we use the nudging for healthing purposes? Or and the same for, why was cigarettes so cool for a certain time, right? Can we now make apples cool, right? Or is there a way that we can make meditation, like can we imagine a James Bond that meditates, right? So just like a star that we look up to, and then having habits that are perhaps better for society than smoking or something like that. So just that kind of looking at what went wrong and then finding ways on to flipping the script in a way as well. Sorry, Anne-Marie, yeah.
No, I was just going to share. So I know there's been some attempts in some cases to put like a tax on soft drinks or on sugary stuff or things. And we go, that's the right incentive. But there was such a backlash from the industry, who funded consumer groups, to say, don't tell us what to put in our bodies or not. Or so the system can sometimes react to these incentives that we try to change and put. So there's also the social acceptance sometimes of some of these policies that we feel like could be a quick win, but what about the reaction of the system to it too, that I think is interesting.
Yeah.
I think that's why it's about feedback loops, isn't it? Rather than just coming up with policy around what's good and what's nice for everyone. If you can really get that feedback loop to really show people, instead of mandating things, really show them the cost and consequences and close that feedback loop, it stops becoming a preaching exercise and more of something that you're setting up a system that's self-regulating in some sense, hopefully. Yeah.
But those mandates worked. So if you look at the data around health outcomes in those areas, you will see positive health outcomes. And it's really an example of the misaligned incentives, like we've been talking about, that there is market power on the part of big soft drink to push against those things because it's not in their best interest, even though from a health and well-being perspective of that community, it is in their best interest, right? So it's a good microcosm of the bigger issues that we're dealing with when we're talking about systemic change in this industry. I do have two things I want to add. One is the example around, well, now I've lost my train of thought because I stared at the chat. It's important for everybody as citizens to get really engaged and active about advocating for some of these changes. Very much like climate change, systems are very intractable right now around doing anything. Health is a very lucrative business worldwide. And so there's not a lot of incentive to change unless citizens get active and uppity. And I'm not saying shoot people in the back like we did here in the US, but demand change as on part of the stakeholders to offer more value for the amount of money that we're putting into the system. And then to add to that is, if you think about the people that we most admire, most people will think about business executives, but they'll also think about pro athletes, you know, footballers in the rest of the world, basketball or football players in North America. What we don't realize is that the reason why those people are perform at such a high level, not just because they're talented, but they're surrounded by a team of people that are dedicated to optimizing their performance all the time. And that is what every citizen deserves. We should all have resources that help us to optimize our well-being and performance all the time. And that's where the system is lacking. We don't have those resources, or they're not aligned necessarily towards optimizing my well-being. They're aligned around monetizing poor choices.
And how do we change that equation is a cool part of it. Great. Thank you very much, Scott. Thank you, everyone else, for your contribution. We will draw to a close because our time is up. Just to say a few words before we get there, maybe Anne-Marie, I'll pass it back over to you.
Absolutely. No, thank you everybody for joining and for staying for this last 90 minutes. In terms of outcome, we'll take the map that we created and make sure it's available to all of you. There's ways that you can stay connected. So if you're not already part of our hub, you can click on that link and join the Systems Innovation Healthcare Hub to join in on the conversation. Follow the LinkedIn page. There's the link there. And then the recording will be available on our YouTube channel. And you can also find past sessions that we've had and some other great conversations that happened previously. What we'd like you to do before you head out is if you could take one of the purple dots, and Josh is showing, if you can put it between 0, it wasn't useful at all, to 10, it was super, very useful. Try to keep the dots the same size as they are there